Hi, Dr. Nahra. How are you?
Good, how are you?
I'm good. I'm better than you because for the past 7 months I haven't been working in with COVID. So can you just tell me what has it been like?
Well, it's nothing like I have ever done before. My situation was a little bit odd. I was thrown into a position that I've never, I've always been the hospital epidemiologist for Cooper, and I do infectious disease and critical care. But it just became very heavy on making recommendations on something that there was no recommendations for. We were very focused on following the literature, whatever was coming our way, whether it's from the CDC, the WHO, being accepting other countries' recommendations as they, especially people who had the experience or had the bad luck to experience it before us, so we could learn from their experience. We also try to take information from prior outbreaks. So we try to dip on other viruses that look like SARS-CoV-2, but is not really SARS-CoV-2.
Yeah. Wow. So were you determining what treatments Cooper doctors were giving to patients?
I was part of the team, so we created. So one of the things that we immediately did at Cooper is put up an IMT with a group or a team of folks with different backgrounds. So to try to drive how we're going to manage the crisis. And within that group, we had the experts from, we created a treatment group. And in that treatment group, we had experts from infectious disease, from critical care, and other areas to come up with recommendations or algorithms protocols of how we're going to treat those patients. And I was part of that team.
Wow. I can't imagine how you determine policies and treatments when nobody knows.
It was very, very, I don't think I will ever forget those past 9 months. It was very challenging and it was literally learning on the job. The internet helped because it brought this huge amount of knowledge together. Like during COVID, it was not only a pandemic was the disease, we had what we call an infodemic. There was so much research done because there is so much focus on it. It was challenging to triage what is good data and what is not really good data. And a perfect example is the hydroxychloroquine medication that was at some point hyped up and people were saying like we need to take it. Um, and until we got the trials that showed it was not really effective, that we could really sort it out. So it was a lot of trial and error and see, like for instance, at some point we were giving hydroxychloroquine. Obviously now we're not, but at some point in time we were. So as you can see, it was very learning on the job as it
Yeah.
comes, which is not what we do. This is not what we do on normal days. So most of our practice is really evidence-based medicine, where you practice what randomized controlled trials told us, what studies have shown to be beneficial and helpful. COVID just switched the way we practice in 1 week. And um, most of medical practice are based on 20 years of experience. And we changed the way we do things overnight almost, which is very different.
Different and like different at the core of medicine because you're always so slow.
Yes.
Yeah.
You accept change because, like, it's somebody's life, right? It could be somebody, it could be my family member. And I treat every patient as if it's my mom, my sister, my kids.
Was there a time when emotionally things just hit really hard?
I think I've been running on adrenaline since
Yeah.
March.
Wow.
The part of COVID that was very difficult for me was the part where we didn't have PPE enough in the country as it is. And we had to make decisions about how we're going to use our PPE and extend the life of our PPE in a safe way. And having to tell that to my colleagues that we have to do this, and then having to look them in the eye and say it will work when I didn't have data to support that.
Yeah.
So that, and it will work because on a common sense standpoint, it will work. But as you know, we don't go by common sense. We go by evidence, and
Yeah.
I didn't have that to back me up. So this was hard. The
Yeah.
other more, the other difficult part of this crisis was the patient sides. You know, having people were dying, they're still dying, and at some point we had no visitors allowed.
Yeah.
I think that part of COVID just it's humbling because like you see how you death is part of life. We're all gonna die at some point, but we all die with somebody at our bedside, whether it's your kid, whether it's your parent, whether somebody's with you. And those moments for those patients, they were very alone. And our staff did amazing in bringing, using technology, having patients Zoom with their loved one. But I can tell it was a difficult time for those people, because whether it is the people who didn't die and stayed behind, didn't have the chance to hug their loved one, to do their, to talk to them. And the person was dying to be so alone. I have this stranger hold up a phone to their face to see or talk to somebody else. That was very challenging. And I can tell you, I still have nightmares to this day about this part of COVID. It was very, I mean, it was difficult. I
Yeah.
hope I don't have to go back to this.
Yeah. I hope so too.
Yeah.
So in a year, when you look, hopefully a year, hopefully not 2 years, when it's over and you look back, what will you think of? I can't believe I did that. What part of it?
Oh, I think that it will be, I think the discussion we had on the PPE, like I
Mhm.
can't believe I looked somebody in the eye and said, I believe it will work when I did have my own, when I didn't have numbers to say, look, this is the numbers that show it will work.
Yeah.
Um, I'm glad it did. We had a very low conversion rate in amongst our staff. And we were able to extend our PPE and use our PPE appropriately. Like we fit tested everyone because at some point we had different types of masks coming to us from everywhere. And usually the process in any institution, normal time, you get from one supplier and you make sure that the mask, which is the respirator, fits the face of the employee perfectly well. And we do testing on that to make sure it fits. So when we were getting different types of masks, we made sure that we tested, despite the crisis, we tested every single employee to make sure that the mask fit. So this is something we did not compromise on. And I think that was a great step because it kept our staff safe.
Yeah.
Um, so yeah, so I think the PPE was one of the most difficult ones. I will never forget that.
So what when you look back, what will you be most proud of?
I learned a lot about myself. As I told you, uh, I was not in the position of making decisions. I think my background in critical care, where you have to make quick decisions fast for the benefit of your patient, you don't have the time or the luxury of taking a lot of time to think. Or you think about your patient, but you have to pull back all of your knowledge to apply to your patient in a very timely manner because somebody's life depend on that. And I think that allowed me to make good decisions um, more on a broader level than just one person. And I didn't think I was capable of that. So it was that part of my personality that I learned during this crisis. And staying calm under pressure because it was very stressful time for all of us. And I think I maintained my mental health and my resilience just showed up to me. I mean, manifested itself to me. I didn't know I was resilient or that resilient.
Great. So you mentioned your children. When you went home, what was that like?
So they were worried that sometime both me and my husband, we are physicians, so they were worried that one of us will get sick.
Mm.
We had to explain.
How old are the
They're
two?
10 and 12,
Okay.
10 and 12. So we had to explain to them that we are taking care, making sure that we are not, we're taking care of ourselves, wearing our protective equipment, washing our hands and stuff like that. Um, One night, my son was very tearful because I think he was scared one of us will die, and he didn't know what he will do with his brother and how he'll take care of him and stuff like that. And we had to explain to them that it's it can happen to anyone, but it's not going to happen today, and
Yeah.
we're taking care of ourselves. So it was type of discussion that I never thought I will have with my 10-year-old and 12-year-old. They're,
Yeah.
they're they're young and they're boys, so they're not that mature,
Yeah. But they're aware. They're old enough to
but
be
they're
aware.
aware. They're aware.
Yeah. Last question. What do you hope we all learn from the pandemic?
There's so much we learned from this pandemic, and one of the things that I think we need to learn is not to underestimate um, the power that we have in controlling it. And by what I say is that masking, for instance, is such a simple act. It doesn't take much. And just by doing that, you can control the pandemic and you have the power to control what's happening around you. Just by a simple fact of masking, for instance, people need to understand that they are in control of their going out and staying safe. So even though we were on lockdown and we've been through a lot as a country and as a society, there is always, it made me understand there is always something that will keep me in power. And I think for this pandemic, it was the mask. It was sometimes something as simple as the mask. It gave me power to protect myself, my family. And um, and if we did that on a consistent base, would actually give us all power to protect, to control this pandemic. I think our chance now is the masks and the vaccination, taking our vaccine when it comes out and it becomes available to all of us. That will put everything under control and help us get over this hump, I hope.
I hope so too.
Yeah.
Well, you're a rock star. Thank you for all that
Thank
you've done over these past months. It's really incredible, and it's everyone is grateful to all of the healthcare workers. So thank you for all that you've done. It was great talking to you. I know you're busy, so thanks for taking the time.
Thank you very much. It was nice talking to you too.